But first, we are getting you some breaking news from the United Kingdom, where a cyber attack has been reported on hospitals. It has sent the government in a tizzy. We are waiting to be joined by our London bureau chief, Mandy Clark, for more inputs on this. But this comes just weeks after we saw another attack in the UK that made international headlines on Westminster Bridge, near Westminster Bridge and the Parliament there. And this is a massive cyber attack that is being reported across hospitals in the United Kingdom. We do not know how widespread it is, what is the magnitude and how serious the situation is, what it means for the patients and how the government is tackling it. But the IT system of hospitals across the country, we are told, has been hacked into, and ransomware has hit public hospitals in the United Kingdom. What it means is that hospitals are unable to accept incoming cases. Mandy Clark, I'm told, is with us. Mandy, what details do we have at this point?
Very much a breaking story. What we do know is that there is indeed this ransomware a lot of hospitals and trusts are reporting. So their terminals where they keep all their patient files were locked down. A clock started ticking down, and apparently they have till next Friday to pay a ransom of 300 bitcoins, and that's around 415,000 pounds. It's nearly £500,000. It's an extraordinary amount of money. And it's not clear. They say if they don't pay it, they're going to delete the files. And of course, these are very sensitive patient files. And it's unclear if that ransom is just for that computer, if it's for the entire NHS. It's very unlikely that a public body would pay a ransom, but it's terrifying for all the patients that are involved. And this is across many parts of the UK, including London, and many non-emergency surgeries have been postponed today because of this widespread cyber attack.
So what are doctors being told right now, and how is the government trying to deal with this?
Would you believe they're writing down things on pen and paper right now? They are not using any terminals, no computers, because they simply don't know how deep this hack is. So they're doing it the old-fashioned way. A lot of doctors are quite upset, of course. They care deeply about their patients, and being held at ransom by an unknown attacker is upsetting. The government has yet to comment on what is going on, but they said the NHS has released a statement saying they are dealing with this emergency immediately, and their IT specialists are on the case. So we'll just have to wait and see if they can claim back their computer from this ransomware.
And who are the people who will be affected the most, Randy? I'm assuming it's people who need intensive care, and if the doctors cannot access their records, it is going to be very difficult to proceed on those cases.
Exactly. You know, you're not sure if patients have allergies, if there's conditions they're unaware of. Of course, it's the elderly who might suffer from memory loss. So these are the people who need the services the most, the people who are most vulnerable and most at risk. So a lot of people commented on how cruel this cyber attack is, because really it's going to hit the most vulnerable in society who needs the most help.
Right. Mandy Clark, we'll wait for more details to emerge on this. But my final question, how many patients could be affected by this? Do we have a number? How many hospitals?
We don't have a number or figures. We know it's many trusts across England. It could be if it's in many of these trusts and hospitals are located in London, that could be up to millions. So it's really hard to put a figure on how many people could be affected. And it's not only that, it's personal information. It's your personal private medical records that are currently in the hands of a cyber attacker. It's a very scary situation for the NHS and all those patients affected.
Right. Mandy Clark, this is a developing story. Thanks very much for joining us with the first update here on WION.